Basics of History Taking, Part 2. Family History. Start with open questions, such as, are there any illnesses that run in your family? Follow up the presenting symptoms with a question like, have any of your family had heart trouble? Document illness in first-degree relatives, that is, parents, siblings, and children. If you suspect an inherited disorder, such as hemophilia, construct a pedigree chart. Social history. The social circumstances of your patient may be relevant to the causes of their illness and may also influence the management and outcome. Establish who is there to support the patient by asking, who is at home with you, or do you live alone? Also, check if your patient is a carer for someone vulnerable who may be at risk due to your patient's illness. Next, establish the type and condition of the patient's housing and how well it suits them, given their symptoms. Patients with severe arthritis may, for example, struggle with stairs. Most patients recognize that habits like smoking and alcohol consumption harm health, so obtaining an accurate history of tobacco use requires sensitivity. Smoking. Ask if your patient has ever smoked. If so, inquire what age they started at and whether they still smoke now. Patients often play down recent use, so it is usually more helpful to ask about their average number of cigarettes per day over the years and what form of tobacco they have used. Convert to pack years. Alcohol consumption. Always ask patients if they drink alcohol, but try to avoid appearing critical, as this will lead them to underestimate their intake. If they do drink, ask them to describe how much and what type they drink in an average week. Occupational history. Recording occupational history is must because work profoundly influences health. Unemployment is associated with increased morbidity and mortality, while some occupations are associated with particular illnesses. Clarify what the person does at work, especially about any chemical or dust exposure. If the patient has worked with harmful materials, such as asbestos or stone dust, a detailed employment record is needed. Symptoms that improve over the weekend or during holidays suggest an occupational disorder. Travel history. Returning travelers are at risk for contracting unusual or tropical infections. Air travel itself can precipitate certain conditions, such as middle ear problems or deep vein thrombosis. List the locations visited and dates. Note details of any travel vaccination. Sexual history. Take a full sexual history only if the context or pattern of symptoms suggests this is relevant. Ask questions sensitively and objectively. Signal your intentions, use questions like, as part of your medical history, I need to ask you some questions about your relationships. Is this all right? Systematic inquiry. Systematic inquiry uncovers symptoms that may have been forgotten. Start with, is there anything else you would like to tell me about? Ask about common symptoms associated with the organ system related to the patient's complaint. Closing the interview. Using simple language, briefly explain your interpretation of the patient's history and outline the likely possibilities. Be sensitive to their concerns and body language. Make sure patients are involved in any decisions by suggesting possible actions and encouraging them to contribute their thoughts. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.